During decades of medical practice, I've witnessed countless patients over 65 walking into clinics with a list of mandatory screenings their doctors insist they need. The harsh reality? Many of these tests may be causing more anxiety, unnecessary procedures, and even physical harm than benefit. Hoy quiero compartir con ustedes las 5 revisiones médicas que, después de los 65 años, a menudo hacen más daño que bien, y por qué cuestionar a su médico acerca de these tests could be one of the most important health decisions you make. The medical establishment has built an entire industry around the concept that more testing equals better health outcomes. This couldn't be further from the truth, especially for those over 65. As we age, our bodies naturally change, and what was once considered abnormal in younger patients may actually be completely normal variations of aging. Yet, many physicians continue to order the same battery of tests they've been recommending for decades, often without considering the unique circunstancias y esperanza de vida de sus pacientes mayores. Let me be clear about something crucial. I'm not suggesting you ignore serious symptoms or avoid all medical care. What I'm advocating for is intelligent, personalized healthcare that considers your individual circumstances, overall health status, and realistic life expectancy. The difference between necessary medical care and excessive screening can literally be the difference between maintaining your quality of life and spending your golden years bouncing between medical appointments, undergoing unnecessary procedures, and dealing with the cascade of complications that often follow. The first screening that often causes more harm than good after 65 is routine mammography for breast cancer detection. While mammograms have been heralded as life-saving tools, the reality for women over 65 is far more complex. At this age, the likelihood of developing aggressive, life-threatening breast cancer decreases significantly, while the risk of false positives skyrockets. These false positives don't just cause emotional distress, they lead to unnecessary biopsies, additional imaging, and sometimes even surgical procedures. Consider what happens when a 75-year-old woman receives a mammogram showing suspicious calcifications. The radiologist flags it as concerning, leading to a callback for additional imaging. This creates immediate anxiety and stress, which can have real physical effects on blood pressure and overall well-being. The follow-up imaging might show the same ambiguous findings, leading to a recommendation for biopsy. The biopsy procedure itself carries risks of bleeding, infection, and significant discomfort for older patients, whose tissues may be more fragile and slower to heal. Even if the biopsy reveals early-stage cancer, the treatment options for women over 75 often involve aggressive chemotherapy or radiation that may actualmente acortar la esperanza de vida en lugar de extenderla. Many of these cancers would never have become clinically significant during the woman's remaining years, yet the discovery triggers a cascade of medical interventions that dramatically impact quality of life. Studies consistently show that women over 75 who undergo regular mammography screening often experience decreased quality of life without any measurable benefit in overall survival. The psychological impact cannot be understated either. The constant worry about potential cancer findings, the stress of waiting for results, and the anxiety surrounding each annual screening appointment can create a state of chronic stress that actually damages health. Many women report that they spend weeks before each mammogram appointment worrying about the results, and days or weeks afterward waiting for the all clear. This chronic stress pattern can suppress immune function, raise blood pressure, and contribute to sleep disturbances. Furthermore, mammograms become increasingly difficult to interpret accurately as breast tissue changes with age. Dense breast tissue, which affects a significant percentage of older women, can mask actual tumors while also creating shadows that appear suspicious but are benign. This leads to what medical professionals call the overdiagnosis problem, where women are treated for cancers that would never have affected their health or lifespan. The second problematic screening is routine colonoscopy for colon cancer detection in patients over 75. While colon cancer screening has legitimate benefits for younger populations, the risk-benefit equation changes dramatically after age 75. The preparation alone for colonoscopy can be dangerous for older adults. The required bowel preparation involves consuming large volumes of laxative solutions that can lead to severe dehydration, electrolyte imbalances, and kidney problems in seniors whose kidneys may already be functioning at reduced capacity. The procedure itself carries increased risks for older patients. The sedation required for colonoscopy can cause respiratory depression, particularly in patients who may already have compromised lung function. Blood pressure fluctuations during the procedure can trigger heart problems in those with existing cardiovascular disease. The mechanical insertion of the colonoscope carries risks of perforation, which, while rare, can be life-threatening in older adults who may not tolerate emergency surgery well. Even more concerning is what happens when polyps are discovered during colonoscopy in patients over 75. The natural response is to remove these polyps. But the reality is that most polyps found in this age group would never develop into life-threatening cancer within the patient's remaining lifespan. The removal process itself can cause bleeding complications that are particularly dangerous for older patients, especially those taking medicamentos anticoagulantes para enfermedades del corazón. The recovery period following colonoscopy can also be more challenging for seniors. The combination of sedation effects, dietary restrictions, and the physical stress of the procedure can lead to temporary cognitive impairment, falls risk, and digestive disturbances that may take weeks to fully resolve. Many patients report feeling not quite right for several weeks after the procedure, experiencing fatigue, digestive irregularities, and mood changes that significantly impact their daily functioning. Additionally, positive findings often lead to recommendations for repeat procedures at shorter intervals. 78 años de edad que ha tenido retirados unos pocos pólipos pequeños, podría serle dicho que vuelva dentro de 3 años en lugar de 10, sometiéndolos a riesgos y ciclos de estrés repetidos sin beneficio claro. The cumulative effect of these repeated procedures and their associated anxiety can significantly diminish quality of life during what should be tranquilos, placenteros años de jubilación. The third screening that frequently causes more harm than good is routine PSA testing for prostate cancer in men over 70. The prostate-specific antigen test has been one of the most controversial screening tools in medicine, and for good reason. Después de los 70 años, la probabilidad de morir por cáncer de próstata se vuelve casi nula en comparación con los riesgos asociados con su detección y tratamiento. Most men who develop prostate cancer after 70 will die with it, not from it. Yet positive PSA results trigger a cascade of interventions that can destroy quality of life. When PSA levels are elevated, the standard response is prostate biopsy, a procedure that becomes increasingly risky with age. The biopsy involves inserting multiple needles through the rectum into the prostate gland to obtain tissue samples. This procedure carries significant risks of infection, bleeding, and urinary problems, particularly in older men whose immune systems may be compromised and whose tissues heal more slowly. Some men develop serious infections following prostate biopsy that require hospitalization and intensive antibiotic treatment. Even when biopsy results show early-stage prostate cancer, the treatment options available to men over 70 often cause more problems than the cancer itself would have caused. Surgical removal of the prostate can result in permanent incontinence and sexual dysfunction, dramatically impacting quality of life. Radiation therapy can cause severe fatigue, bowel problems, and urinary difficulties that persist long after treatment ends. Many men report that the side effects of prostate cancer treatment are far worse than any symptoms they had before diagnosis. The psychological burden of a prostate cancer diagnosis in older men is particularly cruel. Many men become consumed with worry about a disease that likely would never have affected their health, spending their remaining years focused on medical appointments, treatment side effects, and cancer anxiety rather than enjoying time with family and pursuing meaningful activities. The constant monitoring required after treatment, including regular PSA checks and medical visits, creates a cycle of medical dependence that can dominate a man's life. Research consistently shows that men over 75 who undergo PSA screening do not live longer than those who don't. Yet they experience significantly más procedimientos médicos, complicaciones del tratamiento y reducción de la calidad de vida. The irony is that many of these men would have lived comfortably into their 80s and 90s without ever knowing they had prostate cancer, yet the screening process turned them into cancer patients with all the associated physical and emotional burden. The fourth problematic screening is routine bone density testing, or DEXA scans, particularly for women over 80. While osteoporosis is indeed more common with advancing age, the way we approach bone density screening in the oldest seniors often leads to more problems than solutions. Many women over 80 receive DEXA scan results showing low bone density, leading to prescriptions for powerful osteoporosis medications that can cause serious side effects. The medications commonly prescribed based on DEXA scan results, particularly bisphosphonates, can cause severe gastrointestinal problems, including dificultad para tragar, ardor de estómago, y úlceras estomacales. These side effects are particularly problematic for older women who may already have digestive issues or difficulty taking multiple medications. The requirement to take these medications on an empty stomach with large amounts of water, then remain upright for at least an hour, can be challenging for women with mobility issues or those who experience morning stiffness. More concerning are the rare but serious side effects of long-term bisphosphonate use, including jawbone death and unusual fractures of the thigh bone. While these complications are uncommon, they can be devastating when they occur in older women whose ability to heal and recover from complications is already compromised. The jawbone problems, called osteonecrosis, can require extensive oral surgery and may never fully heal, leaving women with chronic pain and difficulty eating. The fracture prevention benefits of osteoporosis medications in women over 80 are also questionable when weighed against the risks. Many of the studies showing fracture reduction benefits were conducted in younger postmenopausal women, and the results may not apply to women in their 80s and beyond. Furthermore, factors like muscle strength, balance, and fall prevention are often more important for fracture prevention in this age group than bone density alone. The diagnosis of osteoporosis based on DEXA scan results can also create unnecessary anxiety and fear of normal activities. Many women become overly cautious about physical activity after receiving a diagnosis of osteoporosis, leading to further muscle weakness and increased fall risk. This creates a vicious cycle where fear of fractures leads to reduced activity, which actually increases fracture risk through muscle weakness and balance problems. The fifth screening that often causes more harm than good after age 65 is routine cardiac stress testing in asymptomatic individuals. While heart disease remains a leading cause of death in older adults, routine stress testing in people without symptoms frequently leads to false resultados positivos y intervenciones cardíacas innecesarias. The stress test itself can be dangerous for older adults, particularly those with unrecognized heart problems or those taking medications that affect heart rate and blood pressure. Durante una prueba de estrés cardíaco, los pacientes deben realizar ejercicio en una cinta de correr o recibir medicamentos que aumenten la frecuencia cardíaca y la presión arterial para simular el estrés del ejercicio. For older adults who may not have exercised regularly or who have joint problems limiting their mobility, the physical demands of the test can be overwhelming. The combination of anxiety about the test and the physical stress can trigger real cardiac events, including heart attacks and dangerous heart rhythm abnormalities. False positive stress test results are particularly common in older adults due to age-related changes in the heart and blood vessels. These false positives often lead to recommendations for cardiac catheterization, an invasive procedure that carries significant risks including bleeding, kidney damage, and stroke. The contrast dye used during catheterization can cause kidney problems, particularly in older patients who may already have reduced kidney function. Incluso cuando la cateterización revela una enfermedad leve de las arterias coronarias, las recomendaciones de tratamiento para adultos mayores asintomáticos a menudo implican riesgos que superan los beneficios. Stent placement procedures carry risks of bleeding complications, particularly in patients who must take blood-thinning medications afterward. The blood thinners themselves increase risks of serious bleeding, including brain hemorrhages that can be fatal or cause permanent disability. The psychological impact of abnormal stress test results can be devastating for older adults who were feeling well before the test. Many patients become cardiac invalids, afraid to engage in normal activities for fear of triggering a heart attack. This fear-based approach to living can actually worsen heart health by promoting sedentary behavior, social isolation, and chronic anxiety. Furthermore, the medications often prescribed following abnormal stress tests can cause significant side effects in older adults. Beta blockers can cause fatigue, depression, and cognitive impairment. ACE inhibitors can cause chronic cough and kidney problems. Statins can cause muscle pain and weakness that significantly impact mobility and quality of life. The cumulative effect of these 5 screening tests creates what medical professionals call the cascade effect, where one test leads to another, and cada intervención crea nuevos problemas que requieren intervenciones adicionales. A woman might start with a routine mammogram that leads to a biopsy, which increases anxiety leading to sleep problems, which results in fatigue affecting her ability to exercise, which leads to muscle weakness, increasing her fall risk, which prompts her doctor to order bone density testing, which shows osteoporosis leading to medications that cause stomach problems, and so on. And this cascade effect is particularly devastating for older adults because their bodies are less resilient and their recovery from medical interventions takes longer. What might be a minor inconvenience for a 50-year-old can become a major life disruption for someone over 75. The cumulative stress of multiple medical interventions can actually accelerate the aging process and increase overall mortality risk. The financial burden of excessive screening cannot be ignored either. Many seniors on fixed incomes find themselves spending thousands of dollars annually on tests, procedures, and treatments that may not benefit their health. The indirect costs, including time spent traveling to appointments, paying for caregivers during recovery periods, and managing medication side effects, can consume resources that might be better spent on activities that actually improve quality of life. So what should you do if you're over 65 and facing recommendations for these screenings? The key is to have an honest conversation with your healthcare provider about your individual circumstances, overall health status, and personal priorities. Ask specific questions about how the test results would change your treatment plan and whether the potential benefits outweigh the risks for someone in your specific situation. Consider your overall life expectancy realistically. Si usted tiene múltiples condiciones de salud crónicas o limitaciones funcionales significativas, la detección agresiva de enfermedades que tardan años en convertirse life-threatening may not make sense. Focus on intervenciones que mejorarán tu calidad de vida e independencia funcional en lugar de aquellas diseñadas para prevenir enfermedades que quizás nunca desarrolles. Don't be afraid to decline screenings that don't align with your goals and values. Many patients feel pressured to agree to any test their doctor recommends, but you have the right to make informed decisions about your health care. A good healthcare provider should respect your autonomy and work with you to develop a care plan that matches your priorities. Instead of focusing on disease detection, consider shifting your energy toward proven interventions that improve health and longevity in older adults. Regular physical activity, appropriate for your fitness level, social engagement, adequate sleep, stress management, and maintaining a sense of purpose have all been shown to improve both quality and quantity of life in ways that screening tests rarely achieve. Remember that the goal of healthcare in your later years should be maintaining independence, comfort, and enjoyment of life, not detecting every possible medical abnormality. The medical system is designed around the concept of finding and fixing problems. But for older adults, sometimes the cure truly is worse than the disease. By taking control of your healthcare decisions and focusing on what truly matters for your well-being, you can avoid the trap of excessive medical intervention and instead invest your time and energy in the relationships and activities that bring meaning and joy to your life. The most important screening you can do after age 65 might be screening your healthcare providers to ensure they understand and respect your goals for your remaining years. Encuentra médicos que escuchen tus preocupaciones, respeten tu autonomía y se centren en ayudarte a mantener la mejor calidad de vida posible, en lugar de simplemente siguiendo protocolos de cribado estándar diseñados para poblaciones más jóvenes. Your golden years should be spent living, not testing.